My name is Moibat Alainer, and I'm presenting healthcare policy on Ghana for class HCA 610. Ghana is a country in West Africa that is rich in resources. It gained its independence in 1957. Ghana is bordered by Togo, Burkina Faso, Cote d'Ivoire, and the Gulf of Guinea. The current population is 30 million people. Ghana is strong with its improving and stable economy. The most popular cities are Accra and Kumasi. The healthcare system in Ghana is improving but inadequate at the same time. They have the system of the cash and carry where you have to pay for your service as you go seek for treatment. Healthcare is very popular in the urban areas, but it's not that available in the rural areas because of the living situation, the education standard, the lack of facilities, medical amenities. The medical healthcare system location concentration is about 1 million in Kumasi and about 2 million in Accra. The healthcare options, they have something called the National Healthcare Insurance Scheme, which was enacted in 2003 but written into law into 2004 and revised and replaced in 2012. There are two options for the NHIC, which are the district mutual health insurance and the private mutual health insurance. Basically, the district mutual health insurance gives the residents the option of enrolling for healthcare insurance, and they usually will be approved about 6 months after the application. They have the initial 5 years to use the insurance for free, except for a few people, such as elders that are like less than the age of 70, or like people that are working class and paying taxes. The NHIS is funded by the NHIF, which is the National Health Insurance Fund, and then it is accredited by the NHIA, which is the National Health Insurance Authority. The NHIS was established to regulate, license, and monitor the operations of health insurance in Ghana, and also to help with the financial risk protection because a lot of people could not afford health insurance. Um, The district mutual health insurance, like stated before, covers a lot of services. Specifically, about 95% of services is covered. However, those services are preventive care and not usually like any care that has to do with like chronic illness, like HIV, the medications for HIV, diabetes, um, coronary heart disease and diseases such of that. So usually the citizens will have to pay out of pocket for those treatments or seek private insurance to cover their expenses. The private health insurance is mostly promoted for like employers, corporations to include as an added benefit for the employees. This is not funded in any way by the government, but mostly by the corporation, and it offers a little bit of the district mutual health insurance in terms of meeting more specific patient needs. So basically, the health insurance for Ghana can be likened to like the universal care insurance, except it's not as efficient as we would find in like Europe, Canada, and hopefully maybe the United States. The healthcare cost in Ghana is it's high and low at the same time per year. They spend about 1600 versus the United States where it's about $51,000 for health insurance. Their monthly premium for those that are required to pay is about $10, usually between $8 to $10. And in Ghana, it's 7 cities to 48 cities. This is still roughly high for that country, especially the low income residents. Again, the NHIS is funded partially by the government and employees based on taxation, 2.5% of contributions from Social Security, and then another 2.5% from the VAT from employee salary. The quality of care is not up to standard, but it's enough to get the citizens by. The most popular illnesses that you find in that side of the world would be malaria, um, typhoid, the usual headaches, probably diarrhea of such, and basically, Ghana is improving and they're doing all they can to provide better care, better facilities, better resources, policy, and funding for the country. They have a growing health expenditure. In 2013, it was 5.4, which was higher than the average income of the country. And in 2016, Ghana experienced a decline in the overall GDP, reducing the total health expenditure to 4.45. Usually, people traveling to Ghana advised to be updated on their immunizations and to probably seek international healthcare insurance if they are to stay there for an elongated period of time. And sometimes people that do work in Ghana are also offered international healthcare options to ensure that all their healthcare services are fulfilled and that they are well taken care of. This is the end of my presentation on Ghana for healthcare policy. Thank you.